there everyone, this is student nurse Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. And today, I will be performing assessing the thorax and the lungs. So, let's go! For the assessment for this procedure, first, assemble the equipment and supplies that you will need in this procedure. The equipment and supplies that you will need in this procedure are first, your stethoscope and the drape if you have a female client like mine, and as the background of the patient. Hi ma'am, I'm student nurse Vince Gerald M. San Miguel. May I have your background? Can I ask your family history of illness, like do you have a family history of cancer?
No.
How about allergies?
No.
How about tuberculosis?
No.
And ask the client about his or her lifestyle. Do you smoke, ma'am?
No.
Do you drink alcohol and beers?
No.
And ask the client about his or her taking medication. Are you taking medication right now, ma'am?
No.
Okay. For the implementation for this procedure is the give. Greet the client, introduce yourself, verify the client, and explain to the client the procedure that we will do. Okay, ma'am. Good day. I am student nurse Vince Gerald M. San Miguel from Nueva Ecija University of Science and Technology, Batch 24. What is your name, ma'am? Tisha Nicole. In this procedure, I will expose your back, but I will use a drape to cover your chest. Is that okay, ma'am? Okay. Then, close the window, close the door, or close the curtain to provide privacy for the client. Then, perform hand hygiene to prevent the cross-contamination for the safety of your client and for the safety of yourself. Then, expose the back of the client. For the assessing the posterior thorax and lungs of the client, we will do first is the inspection. We inspect the client's shape and symmetry of their posterior and lateral views of their thorax. Then, compare the anteposterior diameter and the transverse diameter. Okay, sit straight for me. Okay. Then, ask the client to stand up and check for the spinal alignment for deformities and check for the three normal curvatories such as the cervical, the thoracic, and the lumbar. Can you stand up for me? After the inspection, now we'll proceed to the palpation of thorax. For the clients with no respiratory compliance, just rapidly assess the temperature and integrity of the skin of the client. But for the patient or client with respiratory compliance, assess the thorax area for bulges, tenderness, or abnormal movements. Next, we proceed to palpate the thorax for respiratory exertion, wherein we will use our two fingers. We will put our two fingers to the low thorax of the client, wherein our two thumb adjacent to the spinal cord of the client. Then, check the movement of your thumb while the client taking his or her breath. Okay, ma'am? Can you take a deep breath? After we palpate the thorax for respiratory exertion, now we will proceed to the palpating the thorax for vocal firmities or vocal tactile, wherein you will ask the client to say blue moon or count 1, 2, 3, then just listen or feel the vibration while the client saying the blue moon or he or she counting 1, 2, 3. Ma'am, can you count 1, 2, 3? 1, 2, 3 po. Count po tayo ng 1, 2, 3. 1, 2, 3. Pakilakasan po. 1, 2, 3. Isa pa po. 1, 2, 3. Isa pa po. 1, 2, 3. Na yun. 1, 2, 3. Isa pa po. 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 1, 2, 3. After the palpation, now we will proceed to the percussion. In percussion the thorax, we will use our 2 middle fingers and we will have a 10 points wherein we percuss the thorax of the client, starting from here to here, down to here, next to here, then here, to here, then here, to here. We will percuss the thorax of the client, and the client will cross his or her heart in front like this, and the client will slightly bend forward. No? Can you cross your fingers like this and hold your shoulders? And slightly bend forward for it. Slightly bend forward. After the percussion, now we will proceed to the auscultation. For the auscultation of the thorax of the client, we will use our stethoscope and we will use the flask disc diaphragm. We auscultate the thorax of the client, wherein we percuss the thorax of the client. From this to 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 this. But while we taking the auscultation for the client, we will ask the clients to take a deep breath in her mouth. You will breathe in your mouth po while I'm taking your auscultation for thorax. Then listen to the breath sound in complete 1 inspiration and 1 exhalation. Dress up your client, then perform hand hygiene. Then document all the gathered data from the client's record sheet and report for the abnormal results. Again, Ms. Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. Thanks for watching.